This is the Emergency Medical Minute, sponsored by Health One.
So, how about agitation? How about sedation in agitated patients? We see a lot of agitated patients. It's common, obviously. Trying to sort out the cause of agitation is not always easy. It can be sometimes very challenging, whether it's drugs, alcohol, psych, some other cause for the agitation, like metabolic causes. A lot of times, initially, we don't really care what the initial cause is. We just want to get our agitated patients sedated. So how about we use a lot of different drugs. We try a lot of different things. We don't have anything that's set in stone as far as a certain plan. How about a simple study looking at agitation and control of agitation with medication given parenterally, IM specifically, in 15 minutes. So there's a study in the Annals of Emergency Medicine recently that was done at a large inner city level 1 trauma center that sees about 100,000 patients a year. So probably similar patients that need to be sedated as the ones we see. That's important to always have a patient population that's similar when you look at a study. And what they did is they looked at 740 patients, and the way that they did it was they looked at 5 different IM regimens, and they did a 3-week block for each study agent. So everybody that came in during that 3-week block got a certain medication for sedation, and then they moved on and they kind of looked at success in sedation. And so if you think about it, they looked at about 150 patients for each med, and their primary outcome was the nurses and the docs feeling like the patient was adequately sedated in 15 minutes. So at 15 minutes, they said, you have adequate sedation on your patient. The meds they looked at were Haldol 5 milligrams, Haldol 10 milligrams, Versed 5 milligrams, Zyprexa 10 milligrams, and Geodon 20 milligrams. So things we've all used before. And by far the most successful at 15 minutes, what do you guys think? Any ideas?
Zyprexa?
Yes. So Versed. So yeah, so Versed 5 milligrams at 15 minutes, highly successful. Second place was Zyprexa. The Geodon Haldols were all about the same. The adverse effects were all about the same. There wasn't a big difference in adverse effects, trending a little safer for things like Geodon and Zyprexa. I've been here for 21 years now, and obviously in residency before that, we've used so many different things for sedation. And I think we have kind of drifted a little bit away for acute agitation in the super, excited delirium type patient, away from giving large doses of benzos right away. But it's just another study that shows that it's pretty safe to do and something we should consider first line. A lot of times we'll use, as you guys know, we'll try Zyprexa, we'll try Haldol before starting to add on Ativan, a little bit of Ativan, a little bit of Ativan, a little bit of Ativan. Before then, people have been tortured for about an hour and 20 minutes or so. So just something to consider. All right, thanks.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.